Now, a little review of parasympathetic anatomy. So, we talked about pretty much the head and all the pure parasympathetic fibers and activity that leads to that. And remember, a ganglion is a group of cell bodies, and what we have here is like all these ganglia. I italicized this because, again, I think this is more something for advanced A&P, but there are specific ganglia that supply these tissues and organs of the head and neck. Now, you have all these cranial nerves and like 3, 7, and 9. But what's this big nerve over here? So 3, 7, 9 up there. And then over here we have this huge nerve that supplies all of this. And this nerve is called the... What nerve is this? If you don't get it right now, here's a big hint. Yeah, so like I try like just like how you have that long nerve supplying all these organs, you have this long area supplying all these areas right here. So I like to think of it, this is like vagus, cranial nerve X, right? So this is why the vagus is very important. You notice that supplying all of these internal organs right here in your abdominal pelvic cavity, or yeah, in the thoracic and abdominal pelvic cavities. So that's what we have here with the heart, lungs, and all of these digestive organs here and accessory digestive organs. So what's the difference with the parasympathetic fibers we saw with the head and neck versus the one in our thorax and our abdominal pelvic areas? Yeah. So the difference between the head and neck ones is that notice that the ganglia, again, that swelling that has all those cell bodies, they're not within the organs and tissues themselves. But with here we have the thoracic organs, and here we have the abdominal pelvic organs. And notice that the ganglia are right here, right next or contained within the walls of these organs. So the head and neck ganglia, they have their own separate ganglia that are outside the organs. But over here with the thoracic and abdominal pelvic organs and these internal organs, we have these intramural ganglia. So again, mural, like the mural on a wall, so you think of it inside the walls, you have a ganglia. So again, this is something you see with the parasympathetic anatomy. You don't see this with sympathetic anatomy. Now, with the sympathetic activity in the heart, so let's go over the thoracic organs. With the heart, well, what happens to your heart when you're excited or you have something that's causing a lot of sympathetic activity? What does your heart do? Does it beat slower? Does it beat harder? Does it beat faster? Well, it's going to beat faster and it's going to contract stronger. So what happens is that you increase your heart rate, so that's how many times your heart beats per minute, and you also have increased force of contraction. So you're not only beating faster, but your heart is squeezing harder. So what does that do? Well, the main function of the heart is to circulate and pump blood. So if you're pumping faster and you're also squeezing the heart harder, then you're also going to increase the blood flow. So this is what happens with sympathetic activity. Well, hopefully you're not having a heart attack like this guy, but showing you this is why you get that pounding in the chest. Because again, you're going to try to increase something you call your cardiac output. We cover that more in detail for PHYL 142, so that's like a teaser. So sympathetic activity, increased rate, increased force of contractions. Now parasympathetic, the heart is dually innervated. So when you activate the parasympathetic activity, instead of being faster, so think of it this way, sympathetic for the heart, that's the gas, parasympathetic is the brakes. So the parasympathetic activity is going to put the brakes on the heart, so you're going to decrease the heart rate and you're going to decrease the contraction. So your heart slows down, so it does, compared to the sympathetic activity, like, yeah, you're doing a jog around the block. Do you want your heart to continually beat fast as you're just trying to relax and go to bed later on? No, right? So you want your parasympathetic to take over to give your heart a break because you're not needing that increased activity as much. So yeah, parasympathetic is going to slow, and we cover this more in detail next semester. Now the lungs, sympathetic activity. Now during exercise, again, my classic example for sympathetic activation, do you want your more air being delivered to your lungs, or do you want less air being delivered to and from your lungs? Well, again, Your muscles are working overtime. You want to fuel them with a lot of oxygen so they're more efficient at generating ATP and energy. So you want more oxygen delivery. So what you're going to do is make it easier to get for oxygen to get inside your lungs. So what happens is that your airways, and there are many airways, you notice that it starts off big and then branches out into smaller and smaller airways. So these airways inside your lung, they're lined with smooth muscle, and remember, when muscle contracts, it shortens, right? So if you have a ring of smooth muscle, what's going to happen if you relax it? Instead of constricting, it's going to dilate and open up. Now, is it easier to squeeze through a wide open door or a partially closed door? Well, if the wider you open these airways, the more you can have airflow, or just like opening a window, a partially shut window versus opening it all the way. You're going to get more airflow through a very wider opening in a window. So same with the airways. If they relax, you're going to allow more air in. So this is what the sympathetic activity does. Now parasympathetic, what is it going to do? Well, the lungs are dually innervated, and it's going to cause it to close and constrict. Now you might be like, oh, it's kind of weird. Like, why don't we have it like where it's like, okay, we're relaxed, but this is where it's kind of often confusing. Like they think, oh, parasympathetic is going to relax everything. Not in this case. So the parasympathetic in this case is going to undo the widening you would have with sympathetic activity. So this is what is kind of blocked here, but it's going to constrict and narrow the airways. So parasympathetic activity in the lungs is going to cause the smooth muscle to constrict, thereby reducing airflow into the